Okay, so you may say that, well, then why is vitamin D deficiency so common? All right. First of all, what is vitamin D deficiency? The first definition is that normal vitamin D is about 30 nanogram per milliliter in the blood. Okay. And so if you have less than 20, it's considered deficient. All right. So deficiency is less than 20. Then anything between 21 to 30 is considered insufficient. Then more than 30 is considered good or normal. Okay. And then, of course, we know that there are actually low vitamin D, especially in countries where there isn't so much sun, like in the temperate countries. However, even in Singapore, we have done studies to show that vitamin D can be also fairly common, the deficiency of vitamin D. In the Chinese population, maybe about 30–40%. And then when you go to the Indians and the Malays, sometimes it can be as high as 70–80%. So there are possibly three reasons why vitamin D is also low in Singaporeans. The first is that we all like to be fair. The first thing we ask the government to build whenever we shift to a new house or new estate is, can you have more sheltered walkway? Of course, one of the reasons is we want to shelter from the rain, right? But another reason is we want to shelter from the sun. So we don't like to go under the sun very much. The second reason is that some of us are a little bit darker skin. So the darker your skin, the longer you have to be exposed under the sunlight to get enough vitamin D. So a rule of thumb is that if you want to get vitamin D from the sunlight for a light-skinned person like Chinese, we need to go under the sun 15 minutes, 3 times a week. And then a darker skinned person can be 30 to even 45 minutes, 3 times a week. So most people do have this kind of time to go under the sun for so long. So as a result, we can be quite low in vitamin D. Furthermore, some of us are dressed conservatively. That means we have long sleeve and so on. So it's not easy to expose too much of the sunlight or too much of the skin to the sunlight. So actually, even if you go under the sun, you may not get a lot of conversion. And the last reason is that in older people, the skin is actually quite thin. And therefore, there isn't much of this conversion that can happen in the skin. So for older people, sometimes even if you go under the sun, your ability to convert vitamin D through the food sources is not very good as well. And that's why older people are more prone to vitamin D deficiency. All right. And because of this vitamin D deficiency, sometimes their condition of aches and pain due to the muscle, because when vitamin D is deficient, one of the common side effects is you can have aches and pain in the muscles. So sometimes they are misdiagnosed as fibromyalgia, muscle inflammation, or another condition called polymyalgia rheumatica. So that's how vitamin D deficiency can mimic certain aches and pain condition. And these are all in the muscles as examples.